Well, up next, singer Janet Jackson had a baby at the age of 50, but should you? We're hearing from an expert. Well, as many of you know, Janet Jackson surprised the world when she announced she was pregnant at the age of 50. And last week, she and her husband welcomed their new son, proving it is possible to have a healthy pregnancy at an advanced age. But is it safe?
No kidding. And here to discuss this hot topic with us is Dr. Mark Surrey of the Southern California Reproductive Center. So, Dr. Surrey, tell us, how common is it for women in their 50s to have a baby? And what's the likelihood that she conceived the baby naturally?
You know what, Ellen and Colleen, first of all, thank you for having me. It's become much more common to have children at what we'll call advanced maternal ages because, as you know, there's quite a disparity there with gender. But in terms of the use of assisted reproductive technology, which is what the issue is, that allows women to have babies at an older age, I can't really tell you what she did, but because patients get their own privacy. But yes, by and large, ladies in this age group have had assistance, and usually through the aid of something called ovum donation.
Huh. Let's talk about some of those egg situations. And you have a graphic, and you told us about eggs as based upon age, and we can take a look at that. So the most fertile, obviously, is women in their 30s. Is that correct?
Well, 20s.
20s, 30s? Okay, yeah. we figured just assume 20s, right?
Yes.
But so it really significantly drops after age 44.
And this is reflective of the incidence of healthy births go down, the incidence of miscarriages go up. And it's a physiologic, normal phenomenon that is related to the normalcy, if you will, of the genetics of the embryos produced.
Wow, it is really, I mean, we're looking at that graphic. It is amazing, though, in the part where I'm looking at the 42 to 43. So between 38 and 40, you have a really steep drop when you hit 41. And that really is based on the quality of your eggs?
Yes, it is.
All right. Well, let's talk about Janet Jackson. And does it create unreal expectations, do you think, for, you know, women, older age women, you know, 50 years old? Not that they're old.
Well, you're right, it does. You know, but frankly, many of us can become parents that previously could not with the assistance of reproductive technologies that have really advanced significantly in the last decade or so.
And Dr. Surrey, we're looking at this age and fertility as well. I know as we wrap up our interview, but you can really see, Ellen, we were talking about in the 20s.
Right.
It really does quite a steep drop-off, though, when you hit, you know, your late 30s and early 40s. So
that's true.
Do you have advice for women who are really, and you know, I know we only have a few more seconds, but advice for women who are older and do want to have children? Well,
I think that all women should investigate their fertility. There's a very simple test called AMH, or anti-Mullerian hormone. It's a blood test. You can do it any time during a cycle, and that will give you some insight as to what your fertility may be. It's also possible to preserve your fertility by preserving unfertilized eggs that can be preserved arguably for almost indefinitely.
I guess a lot of women are doing that these days, that have their careers and stuff. Well, they can find out a lot more information by going to your website, and it's the Southern California Reproductive Center. You can go to the website at scrcivf.com, and we thank you so much, Dr. Surrey, for joining us today.
Thank
and
you.
I know there are a lot of topics to cover about this, and we'll have you back. And
definitely, there's so many people are curious about this one.
Thank you very much.